So in your experience, what are the major factors that will affect patients' choice in selecting aid in dying in terms of symptoms or background factors?
Yeah, it's fascinating because everybody says, well, we can control the pain, right? But it's not about pain. If you look at the Oregon statistics, that's generally the 5th or 6th or 7th reason people choose this. The number one reason is autonomy. They are going to die. It's going to happen in a few days or weeks, and they want to have some control over that. They have control over nothing else. They want to make a choice. They want to be in control. There's a particular personality type of people who choose this. They aren't being forced into this. This is something they've known about for a long time. It's another thing that we could talk about is that this doesn't just come up willy-nilly. The conversations have been going on for quite a while.
I'm definitely going to get to that,
Yeah.
but I'm really interested for you to tell me about the symptoms and the types of people and that want assisted dying, and why pain is not the main factor.
Well, one of the reasons that it's not the main factor, I think, is what we've just said. Palliative care programs are fantastic, and they can really come up with new ideas. We can't control all pain, but we can do a much better job than we did even just a few years ago. The second reason is loss of dignity. And loss of dignity, again, like suffering, who defines dignity? I don't define your dignity, David. You define it. And something that you feel very undignified, I might think is fine. You know, I could wear a purple shirt and think it's great, and you might think that you'd never be seen in that.
One, right?
Yeah.
Yeah.
So loss of dignity, and that includes such things as having someone else having to clean you up after you've had a mistake, right. Loss of continence of your bladder or your bowels,
yeah, or your lady with the vaginal cancer,
or the odors that are occurring. So those are the top two. The third one then is anhedonia, which is a big word for lack of pleasure. There's nothing in your life that has any, it's different than depression. There's not one thing in your day-to-day as you're dying
gives you any pleasure.
There's not a single thing that you can see, and that seems to come in, high on the list.
Are those people depressed?
I think it's different than depression. If you look at they're having a grief reaction. Huge difference between depression and a grief reaction.
Right.
We could go through all the points about that. They're sad. Their family is sad. Their doctor is sad. That doesn't change the fact that they're about to die, whether they're sad or happy. Most people wouldn't be happy that they're about to die, in fact.
So this sadness is not depression, not clinical depression.
It's a grief reaction.
It's a grief reaction. It's a adjustment, if we can say. Mm-hmm. Is it able to be treated with medication?
No, it's not really being able to be treated. Fortunately, we have a number of medications and other options now in medicine that really do help with depression. And I saw that in my practice, because when I began in practice, there weren't some of these new selective serotonin reuptake inhibitors and things. Yeah. But they make no difference here. That isn't going to change your loss of dignity, your anhedonia, your autonomy. There's no medicines for autonomy. That's something that comes from yourself.